Hi, my name is KortlynTheriot, and I will be covering how effective communication and conflict resolution is important throughout the nursing profession. First, we have positive communication techniques. These can be used when talking to patients, the patient's family, and coworkers. Using words the recipient can understand will help facilitate a good conversation. Someone who doesn't understand will be less likely to ask you questions in the future. An example of open communication is, "What brings you in today?" which allows the patient to explain thoroughly what is going on. It is important to avoid yes or no questions because it may limit the information the patient is willing to tell you. Using touch when appropriate can help facilitate a good conversation and develop trust. An example is a handshake while you introduce yourself. Listening is an important concept in effective communication and conflict resolution. Active listening is done by giving the speaker your undivided attention, making appropriate eye contact, and using positive body language. It shows you have respect for the speaker and value what they are saying. It is very important to finish listening before speaking. With the use of electronic health records, it is important to be proficient in electronic communication. Accuracy and attention to detail include documenting the truth and being descriptive. Thoroughness and conciseness include covering all the bases in a clear, brief way. Using these techniques will answer questions before they are asked and provide clear communication, which eliminates confusion and errors. Most conflict is created unintentionally by being unaware of how our own behaviors contributes to interpersonal problems. In order to be proficient in conflict resolution, you should understand how others manage conflict. The most common resolution styles are avoidance, which the person withdraws from conflict and neither person is able to obtain the goal; accommodation, which one person puts aside their goals to satisfy someone else's; force, one person achieves his or her goal at the expense of someone else's; compromise, both people give up something to get partial goal attainment; and collaboration, both people actively try to find solutions that will satisfy them both. In order to reach a resolution, we must participate in active listening and be open and respectful to others' ideas. According to McKibben, nurses must avoid the 7 C's before approaching conflict. The 7 C's include commanding, comparing, condemning, challenging, condescending, contradicting, and confusing. All these things can lead to an ineffective conflict resolution. The BSN Essential Number 6 recognizes that nurses must be proficient in communication and teamwork in order to collaborate and provide optimal patient care and satisfaction. Cusin states that as nurses, we should know how our communication style can affect others, and that many people have different ways of communicating. If we can recognize the differences in communication styles, it will ultimately help communicating as a team and resolving conflicts.